PCOS isn't just a reproductive condition. For many women, it affects mood, motivation, energy, weight, and mental health long before it's ever diagnosed. Polycystic Ovary Syndrome, PCOS, is a hormonal and metabolic condition that affects how the ovaries function. With PCOS, the ovaries produce unusually high levels of androgens, also known as male hormone, resulting in an imbalance of the female reproductive hormones. Despite the name, PCOS isn't only about cysts. Not all women with PCOS have cysts on their ovaries. It involves hormone imbalance, insulin resistance, and changes in how the brain and body communicates. PCOS increases the risk of other health conditions like diabetes and high blood pressure. PCOS affects an estimated 1 in 10 women of reproductive age, making it one of the most common endocrine conditions worldwide. PCOS does not have a single known cause, but research points to a combination of insulin resistance, elevated androgens, male hormones, genetic predisposition, and chronic inflammation. These factors interact with the brain, ovaries, and metabolism, creating a feedback loop that sustains symptoms. Common physical symptoms include irregular or absent menstrual periods, acne, excess facial or body hair, darkening of skin around the neck, armpits, groin, and under the breasts, presence of cysts in the ovaries, weight gain, difficulty losing weight, skin tags, fatigue, and fertility challenges. But PCOS doesn't stop at physical symptoms. It is strongly linked to anxiety, depression, low self-esteem, brain fog, and emotional fatigue. Hormonal imbalance, insulin resistance, sleep disruption, and chronic stress all affect neurotransmitters like serotonin and dopamine, which regulate mood and motivation. Living with unpredictable symptoms also creates psychological stress over time. PCOS disrupts the normal feedback loop between the brain, hormones, and metabolism. When insulin and stress hormones stay elevated, the brain stays in a low-grade survival state. This makes motivation harder, emotion less stable, and self-regulation more difficult. There is no single cure for PCOS, but symptoms are often managed through a combination of balanced nutrition that supports insulin sensitivity, consistent sleep and circadian rhythm support, stress reduction, exercise, and medical guidance when accessible. Management of PCOS is individualized. What works for one person may not work for another. PCOS is not a personal failure or lack of discipline. It's a complex condition involving hormones, metabolism, and the brain. Understanding how PCOS affects both mental and physical health is the first step towards managing it with clarity, compassion, and science. This video is for educational purposes only and is not a substitute for medical advice. PCOS affects individuals differently. Always consult a qualified healthcare professional for diagnosis and treatment options specific to you. Want to understand your mind and body better? Subscribe to Neurokind and turn on notifications so you don't miss insights that help you think better, feel better, and live healthier.